G'day and welcome back to the channel. My name's Grant Frost and I'm an Australian trained physiotherapist who's really passionate about trying to better understand why common aches, pains and injuries occur. And in today's video, I want to show you what I've come to understand in my own clinical practice as to the hidden root underlying cause of pain that's either across your lower back, either on one side or across both sides, or pain that tends to travel across your back and down into the side of your hip. And I think this is a really important topic to discuss because it's easily for me one of the most misdiagnosed types of back pain that I would see clinically. So what I want to do in this video is I want to explain to you why we tend to misdiagnose this. More importantly, I want to show you how to find where the exact root cause of that pain may be coming from. And as a spoiler, it's not where your pain is. And then finally at the end of the video, as I always try and do, is I want to try and give you a really good perspective to help you better understand why this exact problem is there for you and what you need to consider to make sure that it never comes back again in the future. So let's get into it. So first things first here, I need to make it really clear that everything that I'm about to go through in this video is 100% based on what I've come to understand clinically, trying to solve these problems for my patients. But as I've mentioned in previous videos, the evidence that I have for this is almost 20 years of problem solving for my patients. And one of the consistent things that keeps coming up with this type of back pain presentation is that the back pain itself is a symptom that's coming from somewhere else. And as I always say on the channel, I never want you to have to trust anything that I say, because if we base everything that we go through on results, as I have done across my clinical career so far, then you'll very quickly be able to understand what I'm talking about in this video. And as I said, we'll get to the techniques that I'll talk about in a second. But the first thing that we need to understand about this type of presentation, it may not feel easy to localize where that pain is. You might be digging your thumbs in and digging around that area yourself. And you may not be able to find the exact spot that generates your pain, despite the fact that you can be in terrible pain. And one of the things that we see a lot with this type of lower back pain presentation is that you may very quickly be sent off to get a scan, whether that's an X-ray or an MRI, to again look deeper in that area for clues as to what might be causing that pain. And one of the reasons why this is so misdiagnosed is that if the scans come back and show a little bit of wear and tear or arthritis on an X-ray, or maybe they show a disc that's bulging a little bit more than is ideal on an MRI, it's very easy for us as clinicians and therapists to make the leap and say, well, you have lower back pain, you have something that doesn't look perfect in that area in your lower back, so it's likely that they're one and the same, that structural dysfunction on a scan is causing your pain. But again, clinically, this can potentially distract us from what's actually causing that pain. But the interesting thing about the presentation of a band of back pain that may translate down to the hip, it may even come across through the front of your groins, is that this fits a very strong dermatomal referral pattern. So what I want to go through in the next part of this video is I want to show you how to self-diagnose the exact part of your spine that might be generating a referred pain lower down through your back. So what I urge you to do is in the comments below, once you've done this technique, please let me know in the comments what your experience is with this technique, because I'm genuinely finding that there is something tangible here that I just don't think we are across enough, to the detriment of the people that potentially could benefit from this. But getting into it, you may recognize again that we're going to use either a foam roller or something like a lacrosse ball or a tennis ball. It doesn't matter what you use. We just want a tool that you feel is readily available, that doesn't feel too brutal, that feels relatively respectful to your spinal tissue. For the purposes of this, I'm going to use the foam roller because it's a bit easier to see. But what I want to get you to do here is, again, we know that your symptoms themselves are more likely at the base of your spine, either traveling out across your back and potentially for some people across your back down into your hip and even down into your groin. This may sound strange, but we're going to forget about where your pain is at the moment. And what we're going to do is we're going to take the roller and we're actually going to go looking, not where your pain is, of course, we're going to come up to the base of your rib cage. And what I'm going to get you to do is very gently lie down on top of the foam roller. Again, you can do this with a ball standing up against a wall. It's the same concept. It just depends on which position and device you feel gives you the best access to what we're looking for here. Gently recline back to whatever degree you feel comfortable. And what we need to do here is we need to just gently roll from one side to the other. And what we're looking for is we're trying to bias the joints in your back. So we're not right on the middle, we're just off to one side where the soft tissue is and the spinal joints. When we're at the base of your rib cage, there will also be ribs attaching into where those joints are as well. We're trying to find parts of your back that feel stiff, tight, and restricted. They may not not be tender. But what I find clinically is when I mobilize these joints at the base of your rib cage and the top of your lower back, the ones that feel tangibly and objectively stiffer, tighter, and more restricted than the other side and than above or below, once we settle on the most restricted joints and tissues in this area and free them up, we can see a tangible reduction in the symptoms further down. And what I've learned is that one of the reasons why this type of dysfunction can be so confusing is because this part of your back is one of the only parts of your spine that refers to other parts of your back. As we get lower down through the lower reaches of your back, that L4, 5, S1, if they're dysfunctional, we tend to see a lot more of those symptoms perpetuate down through the legs. But this sweet spot at the base of your rib cage, the thoracolumbar junction, when we come back to talk about dermatomes, this part of your back, and again, dermatomes have been shown through research to not be exactly the same for each person, but the point here is if you can find the spots that feel stiff, tight, and restricted in the vicinity of this area, and you can just gently recline onto them, take some gentle breaths, give your tissue a chance to give. And once you've done that for 30 seconds, a minute, or longer if you feel it's necessary, you can just go hunting down a little bit lower or up a little bit higher for any pieces of the puzzle there that might be generating your actual symptoms. And this is why it's really important that you don't take my word for this. In that same spirit, we need you to test and retest this yourself to see if anything meaningful changes. So again, in the comments down below, once you have systematically worked your way up and down from that base of your rib cage and settled on the side and the individual spots that you feel are the most restricted, stiff, dense, thicker, tighter when compared to the other side, and you feel you've given enough pressure and time to those areas to help them free up, if you can immediately recheck in with your symptoms and your pain, see if anything has meaningfully changed without doing anything else. And then let me know in the comments down below, because it's this innocuous, relatively hidden part of your back, which is often a hand's width higher than where your symptoms actually are, which I'm finding consistently is driving the referred pain that can be across your lower back, down into your hips, and even wrapping around into your groin. And like anything, if we're not looking above where your symptoms are for clues, then we could be missing the biggest piece of the puzzle, the context necessary to understand why your symptoms are actually there. And then once you've gone through that diagnostic and treatment process and you've come to understand what effect, if any, this is having on your pain, there's so many other things that most people with back pain need to work on: core strength, hip strength, trunk mobility, hip mobility, staying active, managing your stress, making sure you're sleeping really well. All of these things are generally important for most people, and you may need to speak to someone specifically to find out what specific things in those spaces that you might also need to pair with this to optimize how your back is functioning. But there's one other thing that I want to touch on that I think everybody needs to be aware of that helps us better understand why that exact part of your back, that higher potential missing piece of the puzzle, is there in the first place, especially if it's one side more than the other. And what that tends to be is it tends to be reflected in the basic daily shapes and positions that you put that part of your back into the most throughout the day. So when we're trying to best understand this broader perspective here, we can't understand the bigger picture of why that exact lower part of your back has become sore and uncomfortable, where it's potentially referred from slightly higher in your back, if we don't take a look at the shapes and positions or postures that you put that exact part of your body into the most throughout your day. And again, clinically as a physiotherapist, trying to better understand these processes with my patients, the most common cause of this kind of stuff is ultimately sitting. But from a more broader perspective, it can be the position that you put your back into. So for example, if you know that when you put pressure and free up that higher part of your back, it legitimately impacts your symptoms, then that part of your back is likely in some way a hinge point for the things that you may unknowingly be doing throughout the day. Logically, if you're someone who sits a lot throughout your day, whether that's through driving, through working at a computer, or you're someone who just loves to sit down and play video games, or sit up in bed and read, or just sit down in general and do whatever makes you happy, there's a really good chance that there are moments throughout the day where you are unknowingly hinging through that exact part of your back and staying there for long enough that your brain and your nervous system needs to adapt to that position. The increase in isolated load, again, that isn't distributed evenly through a straight back, but directed through that hinge point prompts the tissues in that area to become tougher and thicker and stiffer to support that environment. If you are someone who doesn't sit down a lot, like me as a physiotherapist, and you're standing, bending over a lot, or working down on the ground, there is an equally good chance that there are some shapes and positions that you get into where you're either leaning forwards through that part of your back while standing, or just physically bending through that part of your back more than distributing those forces again more evenly across your spine. And if you have found that that higher part of your back is the underlying cause of your pain, then we need to make sure that we try and address some of those shapes a little bit better by either rolling up a towel and putting it into your back to support you in this position, or when you're bending and leaning forwards, that we make you more hip orientated rather than back orientated. If we don't start to recultivate and reshape some of those shapes, positions, and activities that you do the most throughout your day, then again, we may never reasonably expect this to permanently go away if we don't give it a chance to. But again, as always, thank you for watching. Please keep an open mind and make sure that you base everything that you do on results. Let me know in the comments down below how you went and how this makes you feel. Please consider leaving a like on the video and subscribe to the channel if you want to help support me and you want to be notified when I post new videos. I genuinely thank you for watching and I hope to see you next time. Bye.